for taking time to be here this afternoon for this moment. Dean Hilton. See, I'm already messing up. Dr. Hilton, I am filled with expressions of gratitude for your support and those kind words. Thank you. And Provost Groves, I appreciate you and look forward to what we will achieve together. President DeJoya, my friend, you have been a supporter of my work since I arrived at Georgetown in 2015. Thank you for amplifying my research. Thank you for amplifying my scholarship. And thank you for speaking my name when I was not in the room. I appreciate you for that. As I look around, I see School of Health faculty, I see staff, I see colleagues, friends, and leaders from some of the region's most respected organizations. And I'd be remiss not to mention the presence of my loving family, including my mother, Hazel, my superwoman. For the past 3 years, I've witnessed you overcome so much, Mom. And you've done it with grace, you've done it with dignity. And I've benefited because I have witnessed it firsthand. Thank you, Mom, for being the source of my strength and instilling in me that the glass is always half full. So this is a full circle moment for me. I was born in DC. I was actually born at DC General, and my first job was a high school health educator. I've worked for federally qualified health centers, hospitals, health systems, and I've served on the boards of numerous nonprofits with a mission to create communities where all people can thrive and achieve their full health potential, regardless of their differences. But 2014, that was a year of inflection for me. My experience in the field made it very clear to me that new competencies are necessary for developing clinicians, for developing administrators, researchers, and policymakers. So I made a career shift and decided to enter the wonderful world of academia, and contribute to new ways of teaching and advancing knowledge. Because if we are serious about improving health, we must value and have economic incentives that prioritize prevention, that prioritize wellness. This orientation is going to require us to think beyond the walls of the medical institution. And if we're serious about ending disparities, we have to do some heavy lifting and reflect on our history. We'll have to identify implicit and explicit vestiges of injustice that show up in the systems that we operate in each and every day. And most importantly, we have to have the backbone. We have to have the courage to do what is necessary to undo the damage. So today, as we reflect, all of us, of the past 5 years, we have endured so much. So many events have corroborated the need for new ways of thinking. Because past approaches, well, they just have not resulted in substantive change. COVID-19, for example, it reminded us that we are an interdependent global society with communities plagued by systemic injustice. The pandemic also exposed an archaic public health infrastructure and our inability to partner with communities during catastrophic events. This acknowledgement is especially important as the effects of climate change are likely to lead to a proliferation of infectious disease outbreaks throughout the world. And communities that have been left behind will be the ones that suffer most. Think about what's happening in Mississippi as I speak today. And after the death of George Floyd, on May 25th, 2020, our students of all races, of all backgrounds, they came back to this campus. They came back in the fall with an appetite, with a demand for an educational experience that would prepare them to navigate and lead in a world riddled with injustice. And for those of us in the health space, this was our moment to double down on systems thinking and help students make the connection between concepts such as social determinants of health, redlining, and health outcomes. Recent events have also amplified the effects of environmental injustice and its impact on disease incidence and DNA expression. Now, I can go on, but those were just a few examples of why I am especially proud of a School of Health at Georgetown University. We have the receipts to show that we've been doing some groundbreaking work in these areas. And I must say that I am proud of our name. If we were a school of public health or a school of population health, we'd be expected to follow a blueprint. But this is Georgetown, and we will chart a revolutionary path because the factors that shape health, they're intersectional, they're complex, and to make things even more complicated, our world is dynamic and it is changing very, very rapidly. These radical changes call for change, a change in how we teach, a change in how we seek knowledge. And in light of our rich Jesuit identity and commitment to a purpose-driven life, this is our moment to show up. So what is our opportunity? Through the work of the task force, which you've heard about, we have identified more than 100 initiatives in the health space across this university. These include centers, they include initiatives, certification programs, terminal degree programs. And as we consider the organizational architecture of this school, we are thinking very strategically around how do we harness these assets to deepen our impact locally, nationally, and globally. And of course, through this work, we will uncover gaps, and we're going to explore opportunities for new offerings and new research moments. We're also examining approaches to enhance our work with our health system partner, MedStar Health, and some of those leaders are here this afternoon, including Diane Caslow, right in front of me, who took a risk and hired me as the system's inaugural Assistant Vice President of Community Health in 2010. Diane, it's been 12 years. It's been 12 years. Thank you for everything. You have been an avid supporter. So it's all so very exciting. And as most of you are aware, the school launched on July 1, and it is currently the home of 3 robust departments: human science, global health, and health management and policy. Each department has a robust undergraduate degree program. We also have a nationally accredited Master of Science in Health Systems Administration, and our Global Health Department faculty provides instruction for the Master of Science in Global Health. I do want to take a moment before I wrap up to acknowledge the faculty and staff in the school. So if you could just raise your hand so you can be acknowledged. Those of you who are in the school, great, hot, proud. I just want to take a moment to thank each of you for your dedication, for your hard work, and the impact that you make each day in the lives that we have the privilege to serve, lives of students that we have the privilege to serve. And personally, thank you for entrusting in me with this very, very important responsibility. So I can go on and on, but I'm going to wrap up with my life's motto, and that is, it is incumbent upon each of us to leave this world better off than it was when we arrived. I take this work very seriously, and I am more than confident that together, that is what we will do. We will leave this world better off than it was when we arrived. Again, thank you for your support and the critical role that you are playing in a story that together we are writing. Thank you.